If they would have told my mom this one thing, I think it would have changed everything. Dear mom, do you have a child with eczema? I know it's super difficult and I know it because I've lived it. I'm going to tell you today how to help your child get through this difficult time of their life. And I'm going to tell you the one word I honestly wish the doctor would have emphasized. Are you one of the few? Well, this is the channel for you. My name is Victoria, and on this channel, we discuss all things eczema. If you're from the part of the globe where I am, happy Mother's Day. And I know that a happy mother has a happy child. And if your child has eczema, it's difficult. There's many late nights. There's more oatmeal baths and ointment than we can count, doctor's visits. It's a headache. It's very difficult. I understand it because I've had eczema my entire life. And, my mom, she did the best with what she could with the information that was given to her at that time. But in 2025, we are so lucky that there are resources like this where we don't have to make the same mistakes that I went through when I was a child. And I want to tell you today what I wish they would have told my mom when I first got diagnosed with eczema. I don't remember the day or the hour that I was diagnosed, but when my mom, of course, brought me to the doctor, and like any good mom, she did what they said. She religiously covered my body with the steroid cream that was prescribed, and with the hopes that one day it would go away. And well, here today is one day. I'm pushing 40 and it didn't go away. And I really do believe that if she had done some things differently and the doctors had given her different advice, I don't think I'd have eczema today, or I wouldn't have struggled to the extent that I have. So please listen. The main word that I think I wish the doctors would have emphasized when they did prescribe the steroid cream was the word sparingly. I want to say that back in the day, they used the word as needed, and as needed is not a wise word choice for a steroid cream for those who are struggling with eczema. I'm not a doctor, it's quite obvious, but so I'm not advising you, but I just want to give you some warnings and some things for thought. But if you are going to choose to use a steroid cream for your child, the word sparingly needs to be written on your forehead. It needs to be written everywhere. I think that a safe way to use steroid creams is to not use them at all. But if need be, maybe use it for 3 days on, 8 days off, 4 days on, 10 days off. The days off is very important because your child's skin can actually become dependent on the steroid medication. And if you find that after 3 to 4 days, your kid's medication is not working and you need to go longer, that is a red flag that your child has already become steroid cream dependent. And one day your child will have to go through something called topical steroid withdrawal. So if you are new to the diagnosis, please hear the word sparingly. But more than anything, I want to encourage you to go a different route. So the next thing I wish that my mom knew, or that the doctors would have told my mom, is to be careful with use. Now, I'm an 80s, 90s baby, okay? We're old school, and I came from the time where doctors were prescribing basically antibiotics for common colds. I was using that banana flavored medicine. If you know the flavor, if you remember that flavored medicine, that was an antibiotic. I just thought that was like cough syrup, okay? So that was something, anytime I got even a little bit sick, that's what my mom would give me. Now, the problem is when you have eczema, because your child has eczema, they have a compromised immune system. So giving them something like antibiotics when they're not really sick or in need, sorry, not that they're not sick, in need of it is extremely damaging. So I'm not saying don't give your child the antibiotics, but you better bet your bottom dollar that they needed that medication, okay? Please don't just give it to them willy-nilly because it has consequences on their immune system. If you are already giving your child topical steroids, that has lowered their immune system. Now, on top of it, they're also taking a antibiotic that's going to lower it even further. A child that has eczema needs to have a probiotic rich diet. We're talking not just yogurt, we're talking kefir, we're talking sauerkraut, we're talking kombucha, things that probably the average child doesn't like. And the earlier on you can sort of sneak those things into their diets, the better. Gut health is the big buzzword when we're talking things eczema. And if you have used antibiotics on your child, it has wiped out all the good healthy bacteria in their gut. So it is very essential that you nourish their gut, you get them probiotic that you're taking really on a daily basis, but not just in supplement form, just from natural foods. Stop the creams and let me go through topical steroid withdrawal as a child. Now, I know this is very difficult as a mom. You see your cute little kid, they start developing a rash, and you don't know what to do. You just want it to go away, all right? But so you keep putting on the creams or, because that's what the doctors tell you. But the thing is, one day, if they don't grow out of it, their skin will be addicted to this, and then they're going to have to go through something called topical steroid withdrawal. I made a whole video about that. Please go check that out. Topical steroid withdrawal is not fun, especially as an adult. Okay, so as a mom, if you already have your child on the creams, I recommend letting them go through topical steroid withdrawal. Yes, are they going to look a bit a mess? Yes, they will. Are they going to be uncomfortable? Absolutely. Will they thank you for it when they're 40? Absolutely. Next segment, I'm actually going to get into some of the practices that I really wish my mom knew, that there are alternatives to using steroid creams. So this is the practice that I learned during topical steroid withdrawal, and it's called the no moisture method or no moisture withdrawal. The idea is that you refrain from using products on the skin during a flare or a rash. I have a funny way that I like to remember it, that if the rash is red and inflamed from products you abstain, and if it's dry and crusty, lotion is a musty. You can even teach that to your kids. I'm sure they would love it. But whenever you think of the color red, it means stop. So I coined it more like localized moisture withdrawal. So I'm not telling you to not put lotion on your child's whole body, but let's say they have an area that is covered in a rash and it's red and inflamed, just don't apply anything to that area. You can put lotion everywhere else, just not that area when it's red and inflamed. That will bring the inflammation down. So that is my recommendation for flares. Just leave them alone. Don't put anything on them. When they start to get dry and crusty, then we can move on to products. The second practice that I wish my mom would have known was the vinegar bath. Now, I think a lot of dermatologists like to prescribe something called a bleach bath, and I'm not personally a fan. The idea of me getting and soaking in a chemical just doesn't really ring well with me. However, there is some very good evidence that it's helpful. It's just not something I personally would recommend. A great alternative that is natural, that I feel much better about putting my baby in or my child in, is a vinegar bath. And what you would do, 1 or 2 cups, depending on the size of the bath, of vinegar to the bathtub. If you have an infant, it would be less, maybe a 1/4 cup in one of those small little baths. You could even taste the water. It should start to taste a little bit sour. Then you'll know, like, okay, there's enough vinegar here. I have quite a large bathtub, so I end up putting like 4 or 5 cups in my bathtub. So you kind of got to play around with that amount to see. It will sting a little bit, but what the vinegar does is that it kills the staph that is on the skin. Many people that have eczema, we tend to have an overgrowth of the bacteria staph on our skin. So vinegar is excellent at killing the staph. While simultaneously bringing down inflammation and drying out the skin. So it's great when you come out, you're kind of dry, but so if you had any like oozy skin, that is great. It'll dry that up, and it's a perfect moment to go into no moisture. So you have nothing, you take your bath, soak, take your kid out of the bath, dry them off, and then in those areas that are inflamed or oozy, don't use any moisture. Something that will help your child feel comfortable when they're doing the no moisture and the bath. When they come out, I would put a cold pack on that area. I would let them wear fitted clothing as well, and have them do some jumping jacks or something like that, just to get their body moving. You don't want them to be hot, but you want them to raise their body temperature. It's very important that you get mobility if you're not using moisturizer on your flares, because it can dry up pretty bad and then they don't want to move and they're very uncomfortable, and that is not fun. Something else you can do is you can do a vinegar spray, and that's like an anti-itch spray, I like to call it. So you would do maybe 3 parts of water, 1 part of vinegar. You just put that in its spray bottle, and anytime that your child feels itchy, just spray it on. If you keep the bottle in the fridge, or it will be nice and cold, and you can just spray that on. I would do that no more than 2 or 3 times a day for different areas, of course, but that will also keep the staph down to a minimum on their body. And it's just really, it also has like this odd sting, which can be a bit satisfying when you have eczema, to be honest. The number 3 thing or practice that I wish my mom would have known, the doctors would have told her, is basically to check my mental health. And it doesn't really get talked about enough. And I mean, if you have a baby with eczema, obviously it's like, what do you mean their mental health? Like all they're doing right now is sleeping and pooping and eating. But for whatever reason, people with eczema have very high cortisol levels and very low feel good chemicals like like serotonin, dopamine, and other endorphins. So it is your job as a mom to keep their stress levels down and their happy hormones up. And the best way to bring down those stress levels is to bring up the happy hormones. So please talk to your child, give them lots of hugs and cuddles and fun things for them to look forward to. For adults, we're willing to like think, oh yeah, stress in the body, but kids can also absorb stress as well. A lot of the things we learn about attachment style and all that, all comes back to childhood. So it is very important that you are creating a great atmosphere for your child to feel at ease, that they can come to you. And please keep the physical contact. Make sure you're always giving them love and affection, playing with them. These things will definitely boost their confidence, first of all, because eczema in of itself can be very discouraging for children, but it will also help them to bond to you, let them feel at peace, and raise some of those levels that we kind of have to manually raise, the serotonin and the oxytocin, the dopamine within the eczema patient. My next video, we're going to explore the psychology behind what it means to have a child with eczema, how to have mental grit when it comes to dealing with things like not allowing them to use topical steroid. We're going to talk about how to not burn out as a caregiver, because it is quite challenging when your child is not comfortable. So those are all things to look forward to. Thanks for watching this video. If you haven't already, I have a whole playlist that is dedicated to topical steroid withdrawal. If your child is currently on steroids right now, I really encourage you to go check out that playlist just to get more informed about it. And yeah, look out for my next video.